Now, without further ado, we're really excited to kick off our bi-monthly blood cancer financial Q&A session. At HealthTree, we're committed to support blood cancer patients and their loved ones, not just medically, but financially as well. And that's why I'm thrilled to welcome Diahanna Vallentine, our Financial Advocacy Program Manager. Diahanna brings extensive expertise to today's session, and not only as professional financial advisor, but also as a former caregiver to her husband, who was diagnosed with multiple myeloma. Today, she will be answering your questions and providing trusted guidance on treatment costs, financial resources, and support options. So welcome, Diahanna.
Hello. Sorry, I had a hard time with my button. Wouldn't pay
No
attention.
worries. No worries.
Thank you all for being here. And as Mary Lou mentioned, this is our Q&A. We have these every other month, and I encourage you, if you don't have don't have questions today, but you think of some later on, to sign up for a financial coach. We'll be glad to answer your questions. Just go into healthtree.org, look for your disease, and ask for a financial. Go under coach, and then ask for a financial coach. I think we have 9 or 10 financial coaches out there who are very trained to answer whatever questions you may have. If they're more complicated, they will refer you to me, or if you want me from the onset, please request me on that same financial coach portal. So let's get into the questions.
Yes, let's get to those. So just so you know, there are patients who admitted their questions before the event, but if you have questions, feel free to drop them in the Q&A. So we'll start. My insurance, Regions Med Advantage, just lowered the level of hemoglobin to 10 from 11 to qualify for the shots.
Okay, so if this is a problem for, and this is just your insurance, a lot of insurance handles things completely different. You'll find a lot of variance between insurance companies or insurance plans, how they actually decide what they're going to pay for and what they're not going to pay for. If this is a problem for you, if going to 10 is not going to let you qualify for your coverage for your insurance, if this is something that's, again, is medically necessary for you, you can appeal this to your insurance company. Your doctor can work with that insurance company as well to appeal their decision. And the majority of people who actually file an appeal will actually get a positive response. So I would suggest you talk to your doctor, have them do maybe a peer review, look at and there may be other options for you to get those shots paid for through the through the pharmaceutical company who um, manufactures that type of whatever that medicine is. So I would suggest you talk to your doctor, get a medically necessary request for that appeal in, and if that doesn't work, give us a call and we'll try to figure out what other options are available for you.
Thank you. Let's go to the next one. How does Bristol Myers Squibb or BMS justify the many price increase for Revlimid? The research behind the medicine was done many years ago. The price of it keeps being raised.
Very, very, very good question. And this is the way, unfortunately, a lot of medicines decide how they're going to raise its demand. It's demand, all right? Revlimid, when it was first introduced, was ended up being a flagship medicine for Bristol Myers Squibb. They realized the need for it was high, and there was no other medicine that compared or that they could compete with. So, unfortunately, with this medication, there were several meetings of the board, and the board decided they saw there was a need out there, and because that need was there, people were going to go to that because it was a very effective medication, that they were going to increase the prices based on a board meeting. That happened several times. Right now, Revlimid does have a biosimilar, Rev, lenalidomide, and it will be completely out in the market here pretty soon. And that is going to be the medicine that really helps drive the cost of Revlimid as well as the biosimilar. Biosimilar has been only a few $1,000s less than the Revlimid, but now it will be able to flood the market, anticipate that the prices of both the Revlimid and the lenalidomide will be decreased. So generally, when a medication is brought to market, the price is going to be high because they need to recoup the cost for the research, the trials, and all of this. It goes into making a medicine, and that could be so much money. It could be in, hundreds of millions or more to develop a medication. And so they try to recoup the costs for that because it's very expensive. This has been out for a while. They have recouped that medicine over and over again. But, just like fuel prices go up, rarely do they go back down to where they used to be. We become familiar with it and accustomed to it. We need it, so we're going to pay whatever's out there. So that has been the history of Revlimid. But you can anticipate those prices probably coming down here in the near future.
Thank you. Has the price of Velcade increased in 2025? We seem to be paying more out-of-pocket costs this year.
This is a very good question. It's hard to determine whether Velcade, the street price, has actually increased. What you may be seeing is the increase based on how it is tiered in your formulary for your plan. Your out-of-pocket costs, your copay costs may have increased, although the price of the drug may not have increased. You'll also see a difference in where you pick up that drug, whether it's your pharmacy, whether you get mail order, how many, the quantity of the prescription you pick up, maybe doing a 1 month supply versus a 3 month supply. And it also may be based on the doses that you're getting. Prices also vary between not only your drug plan, insurance plan, but also between um, your where you pick your prescriptions up, your pharmacy, as well as you know where you are located within your geographic location of where your plan actually covers. So there's a lot that goes into the cost of Velcade, and it's very difficult to find out whether the price of that Velcade has actually increased. The actual street amount has increased from last year to this year. It probably has a lot more to do with what your insurance plan is covering.
Okay. Okay. We've been blessed to receive help from grants for my medications, but now that I'm 73, I had to start taking my required minimum distribution. I think this annual amount will push me over the income eligibility. Do you know the income limit now for Leukemia Lymphoma Foundation, Health Whale, or Patient Advocate Foundation? Are there any with a little bit higher limits? Thank you. We've joined your webinars in the past.
Thanks for that question. And this is a lot of things that people don't understand. So let's look at your required minimum distributions. That went from 70 and a half to 73 in the last couple of years. You are required to take as amount out of your 401ks, your IRAs, except for your Roth, when you reach that age 73 because taxes had not been paid on it, and now you're required by federal government to pay taxes on that calculated required minimum distribution. Be aware that requirement of distribution is going to go up. That amount that you need to take out of your accounts are going to go up every year because you're getting older, right? And they want to get their taxes as soon as they can. Now, your requirement of distribution is based on your balance in those accounts at December 31st of the previous year. So any requirement of distributions that are required to come out here in 2025 is going to be based on your balance in those accounts, those 401ks, IRAs, as of December 31st, 2024. When you are getting grants from any of these nonprofits like LLS, HealthWell, Cancer Cares, any of them, they are going to ask for your income verification. That income verification is based on your prior year income. So if you're starting to take your RMD out this year, it's based on last year. Your criteria for qualifying for those grants will be based on your income last year. Now, if you are going to anticipate your income going up this year, then that's going to affect your grants for next year if you've already gotten the grants for this year. What I would suggest you do is talk to your financial advisor. There are things you can do with those required minimum distributions to 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 mitigate not only taxes, because you're gonna be taking out now your income goes up, your taxes are changed, but also to help you manage your overall out-of-pocket costs for not just for medicines and your insurance, but for your other living expenses as well. There are accounts you can use and there are investments you can use that can be manipulated now to help reduce that income if you especially if you don't need that requirement of distribution but you're having to take it. So there's a lot to do. Now on the LLS, it has the highest um, eligibility requirements. That is 600% of your federal poverty level. But remember, that is based on your adjusted gross income, not your entire income for your gross income. It's your adjusted gross income. For instance, if there was one person in your household, that federal poverty level is 15,650. And if it's 600% of that, that would be 93,900. That is will allow you to still qualify for um, the copay assistance programs through LLS. If there's two people in your household, that income now jumps up to 126,900. So it's a very generous, I think, a very generous amount of income where you can still qualify for some of these grants. Now, if you're talking about HealthWell or Patient Advocate Foundation or some of the others like copay.org, it's between 400 and 500% of federal poverty level. So that's still very generous. And again, it's based on your adjusted gross income, not your gross income. And I know yours is going to go up based on your requirement of distributions. But again, I would talk to your financial advisor. There are things they can do to reduce some of those income paying investments you may have that's also pushing your income levels up. If you want to reach out to me, I am a financial advisor. I've worked with people. I'd be glad to give you some suggestions on things you might want to look at to help you stay within those eligibility criteria guidelines.
Okay, let's go to the next one. Can you identify any travel-related resources such as financial assistance to attend patient advocacy seminars or educational informational events, or to check out places that offer stem cell transplant or CAR T that are far away from my state of residence? I'm in Hawaii, and we have very limited resources for advanced treatments. Thank you in advance.
Yes, when you're in Hawaii, you're kind of like locked in. Great place to stay, but when you need more complicated access to healthcare, you become very pigeonholed. I have known people who've been in Hawaii who end up having to either move to California or they have to go like long distance in order to get their treatments. With that being said, on our financial resource page, I do have access to travel where you can get access to travel, not necessarily just for advocacy or seminars, but to get treatment. There are pilots who have their own planes, or you can talk to like Delta. They may have programs to assist people who are going out of town or out of state, especially when you're like almost in a different country. It feels like when you're going to Hawaii to get access to care where you can get that care. They understand that the difficulties people in Hawaii have and the limited resources that Hawaii has for people who need advanced treatments for cancers and other illnesses. Um, for more local things, there's LLS has travel assistance, Cancer Cares has travel assistance, HealthWell has travel assistance. But because you are going from possibly from one state to another state for quite a distance, you're going to need something a little bit more on it, hardy, for lack of a better word, and you're going to need additional costs for travel. And I would suggest you get online and look at those resources. And if you need any additional help with that, reach out to me and we will find additional resources I guess that would be custom to what your needs are.
Diana. Okay, next one. I currently do not have insurance and I'm in treatment and my hospital bills is over 100,000. The hospital gave me their comprehensive coverage and it's really not helping at all. Not sure what else I can do. I also have two oncologists at two different hospitals and I owe them 17,000. This has really stressed me out. And I wonder how I focus on my journey with these financial issues and stress.
That is a lot of stress, and I understand where you are. I've kind of felt a lot of those when my husband was going through treatment. First of all, I don't know what state you're in. I don't know why you don't have insurance because it seems like you should have Medicaid at the very least. And Medicaid will pick up probably all of your costs of your medical care. Um, I'm surprised the hospital did not help get you signed up for Medicaid. In some cases, you can have and I don't know how long you've been in this situation or if you are even on disability. You have a very complex, I don't know enough, I have enough information to give you the information or the answer that you need. I can tell you this, I can help you, but I need to be able to have more information from you in order to answer your questions and get you some relief because there's also um, personal or there are private organizations out there that can help pay your medical bills for you without any requesting anything from you. There are people who can look at your bills and find out if they are actually accurate or not, because a lot of bills are not accurate. To make sure that you are actually paying what are responsible for what you are actually responsible for versus being responsible for an incorrect bill. Please reach out to me. I will be glad to help you individually to figure out what we can do to mitigate this financial stress. I really need to know, again, what state you're in, all these other particulars that I don't want you to get into here, even in our open question and answer forum. I would like for you, though, to get online to ask for me as a coach, and I will be glad to assist you.
Thank you for that. Yeah, reminder, like everyone who is here, you can request Diana or their amazing financial coaches. So if you need more personalized help, please reach out to us and we will help you get one coach. Okay, let's go to the next one. When comparing drug plans, how do you calculate your total cost? And the other within that one, why do Medicare Advantage plans cost so much? Less than standard Medicare Plus, Supplement Plus, and Part D plan.
Okay, this is very interesting. So let's take the first part. When comparing your drug plans, how do you calculate your total costs? Before I forget this, when you're looking at your total costs, you need to be aware of um, additional costs that you wouldn't anticipate, and that would be maybe medicines, and it depends on if you're on a private plan or if you're Medicare Advantage. You know, there's different max out of pockets and other things that go into effect here. But everybody has drugs that are on formulary or not, whether you're private or you're on Medicare Advantage or standalone Plan D. Um, so if you have a drug that's prescribed to you and it is not on your insurance plan's formulary, then you are going to pay for the full cost of that drug out of pocket. So that goes into your total cost, right? You wouldn't know that unless you look at your drug, your if you're comparing drug plans to find out what drugs you have, put those into the plans and find out which ones are going to pay for what. And also be aware that some of these plans, these drug plans, are changing things mid-year, which seems extremely unfair because you would have made the decision to choose a particular plan because it'll cover those specific drugs. But for some reason, some of those things are changing mid-year. So you need to be aware of that. Make sure you know where your drug is on those formularies, what tier they're on, how much they're going to pay. You also need to be aware of course, your premiums. Your premiums are out of pocket. You pay for those premiums. You pay for your copays, you know, that whatever that copay is for that drug. You may have co-insurance attached to that. And any potential gaps as whether your insurance is going to pick up after you reach a certain amount, it may pick up more or less depending on where that is. All of those things come into your total out-of-pocket cost. Again, don't forget those drugs. They're not going to be covered on your because they're not formulary to your prescription plan. And that could be huge. If you don't have like Revlimid has dropped off of most Medicare Advantage plans. If you have not gotten something taken care of that's going to help pay for that Revlimid, which you will need, that is could be $28,000 a month out of pocket. That's very huge. That's very huge. I would suggest you start looking at those ahead of time. If you're coming up on getting a Medicare, maybe look at maybe look at Medigap, maybe look at other particular insurance plans that will cover those medicines you need. And I know who did that. I know who asked that question. Um, Ken. Okay. So why do Medicare Advantage plans cost so much less than standard Medicare plus a supplement plus a Part D plan? Medicare Advantage plans, because they are regulated by the federal government, they you have limited coverage. I'd say limited I could, uh, coverage in the fact that you may not be able to go to any doctor anywhere. The plans, you may be stuck under a managed plan, or you don't have the opened matrix of being able to go anywhere. If you had Medicare Part A and Part B, everybody has to have that to have a Medicare or Medigap plan. With a Medigap plan, as long as a person or provider takes Medicare, they have to take that Medigap plan. Medigap is a more open, broad work network. It's open. Medicare Advantage plans are not open, so you're limited with getting for coverage in your coverage area, and so it's not going to cost as much. You're limited, so we're going to reduce the price on because you're limited as to where you can get your treatments. Um, so I would suggest, I will tell you this, a lot of doctors are saying it's to your advantage to get a Medigap plan versus a Medicare plan, especially if you have a disease where you're going to maybe have multiple experts or specialists for your disease, because you may have to go out and network, maybe not once or twice, especially if you don't have a like a myeloma specialist or whatever type of leukemia you may have in your area, or maybe not in your state, because we don't have a medic a multiple myeloma specialist here in our part of Kentucky or in Kentucky at all. So you have to go to a different state. That is where a Medigap plan really pays off, because anywhere they take Medicare, they will take your Medigap plan, unlike the Medicare Advantage.
Thank you for that, Diana. Okay, next one. I have read that Medicare will not cover virtual visits after the end, by the end of September, except for people in rural area or for those with limited mobility. Is that correct?
So far, they're saying, except for when you, so far the federal government they had extended it to September 30th. It was going to be ending in March, but it's been extended through September 30th. And even for those people who are in rural areas, they'll have to go to a certain place in order to they will have audio, maybe not video, for their coverage. It is being almost wiped out. And I think it's a big disservice to people, because there's a lot of times, if you're in treatment, that you just can't get in a car and go anywhere. And this has been so helpful to get people coverage. It's a little bit different. The requirements are a little bit different from for regular medical health versus mental health. Mental health is going to be extended a little bit more as far as accessibility. Um, but yes, for the most part, it is going to be going away after September 30th, unless it is going to be extended again. Donald Trump did extend that in his in this new administration, and I think people are anticipating he's going to extend that even more past September 30th. Now, we probably won't know for another couple months. I know it's getting really close, but I would talk to your doctor. They are going to be up on the loop on that, because whoever's providing that additional virtual care, it's not necessarily the people that are in your doctor's offices. These are maybe nurse practitioners or doctors that are not employed by that facility where you normally go to. So it's a matter of what kind of platform do they use in order to access your medical records or talk to you. There's a whole lot more in the background versus just doing a virtual. There's a lot more in the background as to how they have been able to put this into effect. And they're looking at all of that now, because again, they're trying to cut down on cost, and this is where the complexity lies, is in how they can keep these things going, because patients want it, they need it. Doctors are saying it's been very advantageous, versus how they can reduce cost for these things going out because Medicare and insurance companies is paying for those virtual visits, but there's additional things that need to be set up in place in order for those things to be managed correctly.
Awesome. Let's go to the next one. Okay, so I'm 62, heading towards SSDI, which I believe is Social Security Disability Insurance. Worried about the Advantage plan I would have to be on until it switches over to Medicare at 65. Not paying enough for denying coverage I might need. Do not hear good about Advantage plan for cancer treatment. What if any options?
Okay, so if you're 62 and you're heading toward SSDI, which means you would probably be going on your 2 years, you have to be on SSDI if you're under age 62 to be on Medicare. It starts in your 24th month. I'm sorry, your 25th month. Depending on what state you're in, most states will offer you not just Medicare Advantage, they offer you a Medigap plan, even prior to age 65, um, which will give you better coverage for your treatment. I would I would suggest you call your state health insurance program. They will be able to tell you what is offered in your state prior to age 62, especially if you're concerned that Medicare Advantage is not going to be covering you as much as you need, and see if you can look at a Medigap plan. The Medigap plan, the best Medigap plan out there would be for you at your age would be the Medigap Plan G. It does more broader coverage for your treatments than the other Medigap plans. And you can also change those Medigap plans and the anniversary date of when you signed up for it. They're not going to tell you that. They're supposed to, but you do have the option to change your Medigap plan as long as you stay within the same type of plan, like a Medigap G, maybe going from United Healthcare G to maybe a Aetna G or whatever. But you need to be aware of what is available in your state. Now, again, I would suggest if you're going toward SSDI again, it is taking some possibly up to 2 years, even with the assistance of an attorney, to qualify for SSDI. That is an issue for a lot of people that you could be without income. What I would suggest you also do is, and a lot of times this is not, it's not done at the same time and it should be. If you are not currently on SSI, so supplemental security income, when you apply for that SSDI or prior to that, like now, maybe see if you can get that SSI, give you income coming in prior to being a qualifying for SSDI. So you'll have something coming in before while you're waiting for that SSDI to go into place. That's what I suggest you do because it could be 2 years, and I've heard some people have taken 3 to get qualified for SSDI, which is horrendous. As you know, the Social Security Department, a lot of their workers, they've laid off a lot of workers, again, cutting the cost. And it was this way 2 years prior to employees being cut. So it's becoming even more and more congested, which means your approval or even for them to even look at your application is being pushed out even more. So I would suggest you start on that as soon as possible. And don't forget the Social Security, the supplemental security income that can click in faster than the SSDI.
Thank you, Diana. Okay, so those were the questions that were submitted before the event. If anyone here at the call has any questions, please feel free to drop them at the Q&A. We already have, so I will start. Um, okay, let me rephrase it a little bit. A patient with smoldering multiple myeloma shared that they've had to dip into their 41K to cover expenses and have already paid taxes on those withdrawals. So I wonder what should patients know about, should know about using retirement savings to manage the financial impact of their conditions, and are there any risks or resources to be aware of when doing so?
There are always risk when you're tapping into your 401k to pay for medical costs, especially early if you're younger and it's prior to retirement, full retirement age, because you're going into that bucket of money and it's dwindling and it's not, and that you can't replace that if you're not working to keep building up your 401k for your longer term needs down the road. I've been preaching this for a long time, and I hope people will listen and take advantage of or understand what I'm saying. It is so important to talk to a financial advisor, to work with a financial advisor. And there's different ways you're going to work with a financial advisor. And they'll tell you about their costs. They're required to tell you about the costs associated with them. But I would tell you that if you have things in investing, the investments, that they can generally boost your investments 1 to 2% more than if you did it on your own. Not only that, they're able to mitigate your taxes. And there are financial advisors who are out there who are trained in the additional healthcare cost because they realize that is a huge need, how that's going to affect your ability to continue to retire, to continue to live. So I would encourage you to do that because these are some of the questions. If you start tapping into, let's say this year when the markets were down, right? You start tapping into your retirement savings now when the market is down, you're getting a double hit. You're taking money out prior to retirement, or you're taking it out when your income, your value of that account is low. And you take it out, it's no longer there to grow when the market starts recovering. And I'll tell you this, generally when markets recover, they do fairly quickly. You can see some market returns. You see how things swing when somebody says something, whether, tariffs are going to be going away, or, you see the market swing. So they may go up with that good information. The same thing can happen with your accounts. They can go up. And if you have taken money out, you don't have that amount of money to go up to recover from with the regular market losses, especially if you're taking money out in addition to the accounts being suppressed as a result of the market. Um, but I would again talk to a financial advisor. They can look at your situation, look at your cost of your health care and determine the type of investments you need to be in, the risk associated with those investments to make sure that you don't go through all your money. They may be able to give you some additional points as to I don't know, extend your money longer than if you're draw it all down, start drawing it down now. It's complicated, but a financial advisor will know those things and they'll be able to answer all those questions for you and maybe be very creative with finding additional buckets for money that you aren't even aware of.
Thank you. We have another questions here. Isn't there a 2,000 cap out of the pocket cost for prescribed medications starting this year?
For Medicare Part D Medicare prescription plans, there is a $2,000 cap that is only on drugs that are covered by that plan. If it's not on formulary, you're still going to pay the full cost of that. That only applies to drugs that are on the formulary.
Awesome. Does anyone have other questions? If not, I'll give it a few seconds, but if not, it looks like we've answered all the questions for now. So I do wonder, Diana, is there anything you would like to share with the audience before we wrap up?
Yes. Everybody's aware of everything that's going on in our country with the cost of care, things happening with the Affordable Care Act, with Social Security disability, with Medicare, with everything. I would suggest you scan that code. Can you bring that QR code up really quickly? Scan that QR code so you can go into Financial Connect. I keep a lot of the most recent developments on there. And you can also put a question in there and I will respond to your question. But it's a way to stay up to date for us to go through to waddle through or find our ways through all the mud and the muck, so you won't have to do it. So I would really appreciate and encourage you to do that. And it's just another resource that we have that can help benefit you in your cancer journey or whatever's going on with you. And there's a lot of questions that people ask that may not be directly related to your care, your cancer care or your cancer journey or the cost of your care. That's going to help you in some other ways. So please join our group.
Awesome. Thank you. Also, I want to remind everyone, and before I close it, I would like to invite everyone to our next financial Q&A event happening. This will take place on July 1st, and we'll be covering a very important topic: blood cancer patients avoid Medicare Advantage traps and Medicaid eligibility pitfalls. If you or a loved one are navigating these problems, this session can be incredibly helpful, and we hope to see you there. And let me go back to our agenda. Also, as you leave the session today, I remind you to taking 2 to 3 minutes to fill out a brief survey about your experience during today's event. Here are just a few of our upcoming events. So tomorrow at 3 p.m. Eastern, we will be talking for the MDS group, what is Bexa syndrome and how is related to MDS. Then on Tuesday, June 17th, we will be talking to lymphoma patients about coping and transitioning into post-treatment survivorship. And then on Monday, June 18th, for smoldering myeloma patients. So should high-risk smoldering myeloma be treated? Exploring CAR T and combination therapy options. We have many and a lot of exciting virtual and in-person events on the works, so stay tuned. The link to sign up for any of those events and many others is found at the bottom of this slide, and we will send it, all these resources on an email, and you will receive it between 48 hours after the event. And I don't know if you hear me out, but I did said in-person events. So this year we're planning on visiting many communities. Connect to Cures is a free in-person event where you can connect with other patients or their families to learn from local doctors and discover key resources with our HealthTree team. We actually already launched it, and Macon, Georgia started last week. At the end of this week, we will be in Peoria, and then Orlando, Harrisburg, Fresno, and we're still planning on places to go. So if you live by near these cities or are closer to where you live, we would be happy to see you there. If you have any questions, please do not hesitate to contact us, and we will be happy to help you. We're also leaving here a QR code so you can scan and save your spot, and we will make sure to include this also on our follow-up email. As always, we would like to thank our sponsor, without whom this event would not have been possible. Thank you for Pfizer, Adaptive, Cura Oncology, Johnson & Johnson, GSK, AbbVie, Amgen, and Taiho Oncology. And before we wrap up, I just want to say a huge thank you to every one of you for being part of our community, and your support really means so much for us, and we're grateful to have you here. I've included my email on this slide, so if you want to email just to say hello if you like this event or not, if you have any questions about HealthTree or any of our programs, I'm happy to help. I truly appreciate each one of you, and I truly hope you have a wonderful rest of your day, and hopefully we can see each other at another webinar soon. So goodbye, everyone.